Assalamualaikum warahmatullahi wabarakatuh. Good night everybody. This is my verbal evaluation video and I will start for it. Task 1 is operating room. Surgical light. I choose surgical light, but the explain about surgical light is referred to as an operating light or surgical light head is a medical device intended to assist medical personnel during a surgical procedure by illuminating a local area or cavity of the patient. A combination of several surgical lights is often referred to as a surgical light system. Next, I choose Sterilization Room or the Central Sterile Supply Department, CSSD. The concept and role of the Central Sterile Supply Department has evolved from just a department in a hospital to a coordinator of a supply work system and sterile equipment. This can be analog to an autoclave unit for sterilization to become an infection control system in a hospital. Ideally, CSSD is an independent department with facilities for receiving, disinfecting, cleaning, packaging, sterilizing, storing and distributing tools according to standard procedure. Next, task 2, anesthesia machine. Number 1, I choose vaporizer. Anesthetic vaporizer is a device generally attached to an anesthetic machine which deliver a given concentration of a volatile anesthetic agent. It works by controlling the evaporation of anesthetic agent from liquid and then accurately controlling the concentration in which these are added to the fresh gas flow. Number 2, I choose carbon dioxide absorbent canister. Soda lime is a mixture of NaOH and CaO chemicals used in a granular form in close breathing environments such as general anesthesia, submarines, rebreathers, and recompression chambers, to remove carbon dioxide from breathing gases to prevent carbon dioxide retention and carbon dioxide poisoning. Next, task 3. Number 1, medical past history. To example, medical past history, to example of expression to ask the medical past history. The first is, since this is your first visit to the practice, I would like to have a more detailed picture of things. Could you tell me about any illness you might have had in the past? Okay. The second is, as an adult, what medical condition have you had? Has anyone ever told you that you have high blood pressure? What about diabetes? Okay. The next in task 3 is about build patient engagement during the informed consent delivery. Patient involvement is now widely endorsed as an essential ingredient for high-quality healthcare. Four communication strategies emerge from the analysis. Number 1. Seeking patient understanding of their condition. Number 2. Explain medical information with refer to share knowledge and practice. Number 3. Recognize and treat the patient psychological problems. Number 4. Repeat important information and check the patient understanding through reteaching. Implementing this strategy allows clinicians to adjust the scope and delivery of information to accommodate and address patient preference, rather than ignoring one-way dumping of information. This identified strategy can be incorporated into medical communication training to facilitate the delivery of health services that are sensitive to patient need and expectation. This study highlights the complexities of information and further contributes to ongoing effort to improve informed consent communication by increasing awareness of the patient role in making mutually acceptable decisions. And the last task is task 4. Explain the procedure of standard induction of general anesthesia. The process of general anesthesia began with a phase known as induction, which is accomplished by two methods: injection of an intravenous drug, the common approach in the adult population, and is a rapid process in which unconsciousness is achieved roughly 1 minute after administration of the induction medication. All of the agents used for induction produce and expect apnea, and airway management skill is essential. In the pediatric population, where gaining IV access properly isn't well tolerated, a volatile anesthetic agent by monks in the preferred approach for induction. Compared to intravenous induction, and inhalation induction require more time to take effect, and the patient may demonstrate progression through the various stages of anesthesia not seen with an intravenous induction. Okay, thank you.